Hi guys, Jack here from Choose Health, and today is Tuesday, so it's time for your weekly health tips video. I wanted to talk a little bit today about lateral hip pain on this bony bit on the side of your bottom and hip, in which it becomes sore in various different people. Particularly this time of year we see a bit more of it, but it's kind of year round as well, but it's just when people start to do a little bit more, especially moving, twisting, turning. Gardening's a classic one, or as we've seen, people getting out and about and being more active, which of course we encourage, but it just means that if they do that quite suddenly, this is an area that starts to become painful. Now there's a tendon on the side of the buttocks as well as a fluid-filled sac called a bursa, and that pain in that region is generally called greater trochanteric pain syndrome. So it's just talking about the location and the fact that it's a painful condition. Now there's a few things to do prior to even consulting us on this, or some top tips that we'd give you when it becomes sore in that area, if it is indeed that condition, which is hard for us to go through the details as to how you know, but if it's tender in that area, that tends to be the most common condition. And simply avoiding crossing your legs for a period of time as best you can, although not completely avoiding it, but just reducing the amount you cross your legs over each other. Lying on that side, you probably work that one out yourself, is sore, so try to avoid that, and overnight it's quite challenging, but generally speaking, try and use pillows to try and avoid rolling onto that side if you can. And then also when you're standing, try to avoid standing on one leg rather than the other, sort of over leaning on one side. Try to distribute your weight more evenly. Tends to be some top tips to try and reduce that. That's only a short-term fix though. Essentially that's avoiding things which we rarely encourage you to do. So if that's a short-term thing to try and help regulate symptoms, to get it better we need to try to involve the tendons in that area and start to expose them to the things that they don't like at a dosage that is appropriate for you, and identify any other risk factors that might be contributing to your symptoms, such as inflammatory variables, how's your sleep, how's your overall wellness, what exercise are you doing, where are you weak, where are you stiff, etc. So that's where you need to consult us, choosehealth.co.uk, for future bookings, or give us a call and we will help you there. Just like and share the video, like and share the page, comment below and we can get in touch, and hopefully we can help you out with your sore bits so you can keep doing what you love. Okay, but we'll see you soon at Choose Health.